Hello everyone, with you Dr. Demchenko. Today I will tell you why pain and knee joint swelling can persist for a very long time after any knee surgery or injury. The most common reason why swelling does not go away and there is pain in the knee area after any surgical intervention is a deficit of knee joint flexion. The most important thing is not that the knee bends well, because everyone after surgery actively develops bending, but specifically the very end of the knee bending. When your knee does not fully extend, the kneecap is constantly in compression with the femur, because only with full extension does decompression occur, relieving pressure from the kneecap and relieving pain syndrome and swelling. If you constantly walk with a slightly bent leg, it reduces the length of the step and gives constant compression to the cup. That is, the knee will constantly hurt and will be swollen. Therefore, the most important thing after surgery is to develop the end of the amplitude of extension in the joint. How to evaluate this and the best complex for extension will be shown to us by Timur Utevlenov.
Hello everyone. First of all, we need to assess the volume of flexion in the knee joint to determine whether we need to further flex it. The simplest test is to lie on your stomach so that the legs go beyond the limits of the table, the knee cup goes beyond the limits of the table. And with this position, we can quite accurately assess whether there is a deficit of flexion in the knee joint. In this case, we are assessing exactly the passive flexion. For example, this is approximately how an expressed deficit of flexion will look specifically in the right knee joint. To assess active flexion, that is flexion that is performed with the help of muscles, we can use a test. We put one hand under the knee and the other hand under the heel. And the task is to lift the heel without tearing off the knee. The important fact is not the lifting of the heel itself, but the difference between an injured extremity and a healthy extremity. Typically, the heel can be lifted about 1 to 1.5 centimeters. With a flexion deficit, the picture will look approximately like this. The heel will not lift or will lift with a jerk of the knee from the hand. For the first exercise, you will need either a mat or a towel. That is, we fix it in the stop. With the other hand, we fix the knee and start actively lifting the heel. And while doing this, we try to keep the knee in place. Mild discomfort is allowed when performing the exercise, mild pain. The average number of exercise repetitions is 10-15. The exercise is done slowly. For the second exercise, we will need a ball which we place under the knee joint. And here we get a combination of 3 movements. That is, this is pressure on the ball, maximum bending of the knee, and bending the foot towards yourself. And in this position, fixation is needed for a couple of seconds. Then we slowly relax the leg. Then we repeat this movement. At the end of the movement, we want to feel a good tension in the quadriceps muscle of the thigh. It is this muscle that is responsible for the end point of the amplitude of the knee joint bending. The average number of exercise repetitions is 20 to 30 times. The third exercise is active bending of the knee joint. For this, we need to fix the knee with one hand so that it does not lift off the table, and try to actively lift the foot 20 to 30 times with a slight fixation at the end of the amplitude. If we can't do this exercise, then we need to continue doing the first and second exercise. Finally, we can reassess the active flexion.
Did our exercises have an effect on
the amplitude of movement? And usually we see an improvement. That is, the person starts to bend the leg to the end.
Usually this complex of exercises allows you to feel relief when walking, squatting, and reducing swelling even the next day. Tell me, how long do these exercises need to be performed, and how soon after surgery can they be started?
In fact, the sooner they are performed after surgery, the better. To see any solid results in improving flexibility, they need to be performed for at least 2 weeks. Then we can evaluate their effectiveness.
So essentially, if you do a flexibility test in the morning after 2 weeks of these exercises, without doing anything important before the test, and both knees perform the same, we can consider the set complete and move on to other exercises. I understand that this is just the beginning of rehabilitation. Then strength exercises, coordination, and the rest of the knee joint recovery program after surgery start, right?
As a rule, yes. That is, if a person does not have full amplitude, then strength exercises, on the contrary, lead to even more deflection and even more reduction of amplitude.
As a sports doctor, I see this very often when people, without fully working through the flexion, are given exercises with rubber bands, knee flexion in the machine, and this unfortunately only leads to an increase in swelling. Thank you very much for showing me this effective complex. I have seen it more than once on our patients and how it works, and I recommend it to you for maintaining your health and improving the function of your knee joints. Good health to all. Bye.